I want to tell you a short story about a patient of mine. Let's call him Robert. Robert was 68. He was active, he played golf, he loved his grandchildren. One day, he came to me and said, "Doc, I feel great, but my voice has been a little raspy for a month. I think it's just allergies." He didn't have pain, he didn't have a fever, he just had a frog in his throat. Because we caught that whisper early, Robert is still playing golf today. It was early-stage laryngeal cancer. But I have other stories of patients who felt a lump and waited 6 months because they were too busy or too scared. And those stories, they have different endings. Cancer is the word we fear most. We imagine it as a sudden lightning strike. But the truth is, cancer is rarely sudden. It is a thief in the night. Long before it breaks down the door, it tries the windows. It makes small noises. It sends signals that are so subtle, we often mistake them for just getting older. In this video, I am not just going to list symptoms. I am going to teach you how to be a detective for your own body. I will share 9 specific warning signs, some of them incredibly strange, that cancer is growing inside you. I will tell you the real-life stories of patients who ignored them and those who listened. And I will explain the biology of why these things happen, so you understand exactly what to look for. This video is not to scare you. It is to arm you. I'm Dr. Anya. Let's turn on the lights. Let's start with the most deceptive sign of all, the one that feels like a blessing. Unexplained weight loss. The story of Martha. I remember Martha. She was 72. She came in for a checkup, beaming with pride. She said, "Dr. Anya, look, I fit into my daughter's wedding dress. I've lost 15 pounds in 2 months. I asked her, "Martha, have you been dieting? Have you cut out sugar? Are you walking more?" She said, "No, that's the best part. I'm eating the same as always, but the weight is just melting off. Isn't it a miracle?" My heart sank. I knew immediately it wasn't a miracle. It was a thief. We ran tests, and we found a tumor in her pancreas. The mechanism. Why does this happen? This is a condition called cancer cachexia. Cancer cells are not just lumps of tissue. They are metabolically active parasites. They are building a city inside you, and they need materials. They release chemicals, cytokines, that hijack your metabolism. They literally instruct your body to break down your own muscle and fat stores to feed the tumor glucose. You're eating, but the tumor is taking the calories first. The red flag. If you lose 5% of your body weight, that's about 10 pounds or 4.5 kilograms, in 6 months without trying, you must not celebrate. You must investigate. Martha caught it in time to get surgery, but if she had waited another 2 months to enjoy her weight loss, it would have been too late. Sign number 2 is often dismissed as menopause, even in women who are 70, or the bedroom is too hot. Persistent low-grade fever and night sweats. The story of David. David was a robust man of 65. He started waking up at 3 a.m. completely drenched. His pajamas were soaked through. He would change his shirt, go back to sleep, and wake up fine. During the day, he felt normal. Maybe a little tired. He told his wife, "It's just the summer heat." But it happened in October and November. Finally, he came to me. It turned out to be non-Hodgkin's lymphoma. The mechanism. Why does cancer cause fever? It is a sign of war. Your immune system is not stupid. It sees the cancer cells, especially in blood cancers like leukemia and lymphoma, and it tries to kill them. To do this, it releases inflammatory signals. These signals travel to the hypothalamus in your brain, your internal thermostat, and turn up the heat. The body is trying to cook the invader out. Also, tumor cells grow so fast they can outgrow their blood supply and die, necrosis, which releases toxins that cause fever. The red flag. If you have a fever over 100.4 degrees Fahrenheit, 38 degrees Celsius, that lasts for more than 7 days with no runny nose, no sore throat, and no flu symptoms, see your doctor, especially if you are soaking the sheets. Sign number 3, the lump. Now, we're taught to look for lumps, but most people look for the wrong kind of lump. The story of Sarah. Sarah found a lump under her armpit while showering. She pressed it. It felt hard, like a marble. But here's the fatal mistake she made. She pressed it hard and she said, "It doesn't hurt, so it must be okay." She thought pain meant danger. 6 months later, the lump was the size of a golf ball. It was breast cancer that had spread to her lymph nodes. The mechanism. Please listen to this distinction. Infection lumps, the grape. Usually soft, squishy, movable, and tender. They hurt when you touch them. This is your body fighting a cold. Cancer lumps, the stone. Usually hard, rock-like, fixed in place, they don't move under the skin, and painless. Why painless? Cancer grows stealthily. Unless it's pressing directly on a nerve, the tumor mass itself has no pain receptors. It grows quietly. Pain is a late sign. If you find a hard, painless lump in your neck, armpit, or groin, and it's still there after 2 weeks, after any cold has passed, you need an ultrasound. Don't wait for the pain. This next sign is the one that people ignore out of embarrassment or fear. Blood. Blood belongs inside your circulatory system. If it is leaving your body, something has breached the wall. The story of Michael. Michael saw pink urine in the toilet bowl one morning. No pain, just pink. He thought, maybe I ate beets. Maybe a kidney stone passed. It went away the next day, so he forgot about it. 3 months later, it came back, dark red. It was bladder cancer. The mechanism. Tumors are messy eaters. They create their own blood vessels to feed themselves, a process called angiogenesis. But these new blood vessels are weak and leaky. They rupture easily. Blood in urine, bladder or kidney cancer. Blood in stool or black, tarry stool, colon cancer. Blood in phlegm, lung cancer. Vaginal bleeding post-menopause, uterine cancer. The red flag. If you see blood once, it might be a fluke, hemorrhoids, infection. But if you see it twice, you have no choice. You must check it. Michael survived because he came in the second time. Don't be embarrassed. We're doctors. We've seen it all. Skin cancer is the most common cancer, but often the most ignored because we think it's just a sunspot. The story of Elena. Elena was 60. She was diligent about her face cream, but she had a small, dark spot on the sole of her foot. She never looked at her feet. Her podiatrist noticed it and said, "That looks strange." It was a melanoma, and because it was on her foot, it had grown deep before anyone saw it. The mechanism. Melanoma is aggressive. It can spread to your brain and lungs quickly, but it gives you visual clues. We call it the ugly duckling sign. Look at your moles. They should all look like a family, similar shape, similar color. If you have one that looks like the outlier, darker, jagged, weird, that is the killer. The ABCDE rule. I want you to memorize this today. A, asymmetry. Is it lopsided? B, border. Is the edge blurry? C, color. Is it black, blue, or red? D, diameter. Is it bigger than a pencil eraser? E, evolving. Is it changing? Check the places the sun doesn't shine. Between your toes, under your nails, your scalp. Ask your partner to check your back. These two signs go together because they involve the throat and chest. Sign 6. Dysphagia, the stuck food. Have you started avoiding steak or dry bread? Do you find yourself drinking water with every bite to wash it down? The story of Joe. Joe stopped eating meat because he said it was too tough. He switched to soup. He didn't realize that his esophagus was narrowing due to a tumor. If food feels like it gets stuck in your chest, that is a classic sign of esophageal cancer. Sign 7. The raspy voice. Like I mentioned with Robert at the beginning, if you sound hoarse for 3 weeks, it's not laryngitis. Here is the fascinating and scary anatomy. The nerve that controls your voice box, the recurrent laryngeal nerve, loops down into your chest, right past your lungs. A lung tumor can press on this nerve, so a raspy voice can actually be the first sign of lung cancer, even before you cough. If your voice changes, get a chest x-ray. This one is specifically for the ladies. Persistent bloating. We all get bloated after a big meal. It goes away by morning. But if you wake up bloated, if you feel full quickly, and if your pants feel tight even though you are losing weight elsewhere. The story of Linda. Linda thought she was just gaining middle-aged weight. She bought elastic waistbands, but she also felt the need to urinate frequently. These are the whisper symptoms of ovarian cancer. It is called the silent killer because the ovaries float in a large space, so tumors can grow huge before they cause pain. But they cause fluid buildup, ascites. That is the bloating. The red flag. If you feel bloated almost every day for more than 3 weeks, ask for a pelvic ultrasound. Do not let them dismiss it as gas or IBS if you are over 50. We have covered a lot. Weight loss, fevers, lumps, blood, skin changes, swallowing issues, bloating. It feels overwhelming. You might be touching your neck right now, worried. Please, breathe. Remember, a symptom is not a diagnosis. Most lumps are benign cysts. Most coughs are allergies. Most bloating is just dinner. But you have a responsibility. You are the only person who lives in your body 24/7. No doctor knows your body like you do. If you sense something is off, if you hear that whisper, listen to it. The 2-week rule. Commit to this today. If a symptom is new, strange, and lasts longer than 2 weeks, you make the call. You go to the doctor, you tell them Robert's story, you tell them Martha's story. You advocate for yourself. Because catching cancer at stage 1 is a nuisance. Catching it at stage 4 is a battle. Let's choose the nuisance. I'm Dr. Anya. I want you here for a long time. And to help your body fight off these mutations before they even start, you need to fuel your immune system. Watch this video next on the top 5 anti-cancer foods that starve tumors of their blood supply. See you there.